So today we're going to be talking about preparing for the digitisation of social care. So hopefully that's of interest to everybody that's joined us this afternoon. So just a little bit of background about us and why this is something we're talking about. So my name's Grace and I'm from Rotamaster. We have 23 years in providing workforce management to a wide range of health and care providers. We work across 4 sectors, including community care, residential care, primary care and NHS trust departments as well. We have over 60,000 health and care staff members using our software on a day-to-day basis, and we are the only workforce management software designed exclusively for health and care organisations. So just to give you a bit of background, we are very well versed in health and social care as well. And we just wanted to talk about some of the challenges that are currently being faced by social care and hopefully some of the improvements that are aiming to be made in the near future. So by way of introduction, the Social Care Fund has been announced. 25 million has been made available by the NHS Transformation Directorate, and that is via ICSs. So people can apply via that ICSs for part of this fund. And the aim of this fund is to improve high-speed internet connectivity and devices for care providers, to adopt fall technologies, which would hopefully reduce the frequency and severity of hospital admissions, to digitise social care records, to ensure that data is captured that could easily be shared between care settings and, of course, with healthcare providers as well, and to test out other care-based technologies such as workforce management solutions based on local needs. So transformation is very much needed in social care. And why is this important? Social care providers, 30% of social care providers are still using entirely paper-based systems. So when we compare that to, you can't imagine going to your GPs and them writing everything out on paper and putting it in a filing cabinet. All of the healthcare settings are digitised in terms of healthcare records. So the fact that 30% of social care providers are still using entirely paper-based systems really does show the inequity between social care and healthcare. Only 45% of social care providers have any form of DSCR. So again, quite a surprising statistic and definitely something that can be improved with this funding. 60% are still using internet connections which are unable to facilitate full digital transformation. So really this funding is hopefully going to assist social care providers in harnessing the power of the internet to improve the care that they can provide. So let's address the key driver of transformation. You really do need to have the infrastructure in place that lays the foundations for any technology that you're going to implement. So having high-speed internet is imperative. And as the previous slide said, almost 2/3 of care providers don't have adequate internet services. That is something in this day and age that can and should be easily rectified. And again, hopefully this funding is something that can be used to address that. Only once that is addressed will the providers be able to embed new technologies which will support them in running their care homes, including the digital care records, communication platforms, security, workforce management, care planning, whatever it might be. And certainly workforce management, as I mentioned, is in that list. So if that is something that's of interest, then of course, please let us know. Engagement and communication tools for staff members. So things that will allow your staff to engage with you as a workforce provider will be very useful also. In terms of the digital social care records, the task is, or the challenge is, to ensure that 80% of CQC registered adult social care providers have a digital provision in place by 2024. And shockingly, we already are a quarter of the way through 2023. So that will be coming at us in no time. And that 80% is a big 35% increase in the current scenario. So quite a big challenge, but hopefully with this funding, we'll go some way to help providers implement that. Providers who do implement the digital social care record will be able to share information faster between themselves and healthcare providers. So hopefully if the patient is transferred into another setting, they will be able to have a complete record of that person's needs and healthcare requirements, which will of course improve care no end. data and processes will be less prone to error. So, you know, the time-consuming nature of paper-based processes, we're all aware of what those are. Things getting lost and get lost in translation as well. And hopefully having a digital record will eliminate that completely. This will lead to a more personalised care for individuals. So even down to things like people's preferences of food and drinks, visiting with family, all of those sorts of things that we might take for granted as people who can communicate. If that's something that a patient is unable to do, having a digital record of all of that will certainly assist providers in being able to provide excellent care to that person and reduce administrative burden on already stretched staff resource. So, you know, poor staff members with having to manage huge amounts of paperwork, it's certainly not ideal. So I think the move towards digitising care records will be a huge benefit for everybody involved. Fall technologies are another one of the areas that the fund can be used for. So we know that falls cost the NHS around £2 billion per year, which is enormous. And the monitoring is vital, given that it's able to reduce falls in care homes and subsequently hospital admissions by up to 20%. So anything we can do to keep people out of hospital is extremely beneficial. There are a range of tools that can be adopted, including sensors, video technology, wearable technology. There's also newly emerging AI technologies as well, all designed to help prevent falls and serious falls as well. So all of that is available to be looked into. So in terms of what you can do as a provider, 3 things you can do today to make a positive impact are these small things, hopefully, that might have a big impact. So number 1 is check your current infrastructure. So ask your IT team, or if you need to bring someone in to have a look, what is required to progress with digitisation? Is your internet speed up to scratch? Would you be able to implement a system to help you? Or is that something you need to improve before you can progress any further? So I think just having the foundations in place is vital. Commit to a digital social care record. So I think having the idea of implementing that at the heart of your operational plan and ensuring that you are taking the necessary steps to facilitate this. You know, everyone knows the benefits. That's never something anyone's going to argue against, but actually doing it in this, you know, in times when providers are so stretched and funding and resource is difficult, actually committing to moving forward with that, I think, is a big step in the right direction. And also following the progress of other providers and what they're doing, joining forums and communities online. People can share success stories. I know we have a lot of recommendations via these types of forums and even Facebook pages from providers who've adopted certain technologies or asked about certain technologies and received recommendations from other providers. So I think anything you can do to increase communication with other providers and find out where they've been successful is a very easy and hopefully a useful thing to do. So in conclusion, the digitisation of social care is, you know, thank goodness, a pressing priority for the NHS. But as part of that, could a workforce management platform be at the next stage of that? So we do work with a wide range of healthcare and social care providers. We are noticing with our social care providers that a lot of them are seeking to adopt care planning technology, and workforce management is usually kind of the second thing they want to adopt. So in terms of how Rotamaster can help, it can help you digitise your workforce. So get all of your staff members online, viewing shifts, booking to additional shifts, overtime, etc. It can really help to engage staff members. So you can send out messages with alerts for last minute shifts or requests, notes about a particular shift, or any additional information that staff members might need to be aware of can easily be sent out by the system. It will help you make the best use of your staff resource. So we have an algorithm in Rotamaster that will basically give you the highest possible level of shift fill based on your staffing numbers, which is very hard to do in a short amount of time. Manually, it will share out the shifts. It will also focus on matching, skill matching to patient needs. So if you have a particular patient that requires a particular skill, it will match the employee to that person based on the skills that are required. It will also help you monitor compliance, so ensure that all your staff's compliance is up to date and you have all of those records stored on the system as well. And any alerts that anything that's due to expire, you can have alerts about as well. It can automate timesheets, ensure payroll accuracy, so just a lot of time saving in terms of admin. And it can help manage annual leave, sickness and other absences. So leave can be booked via the staff portal. It can all be viewed by the manager, again, online. So it's very easy versus managing it all on paper. And reporting can all be done on the system as well. So anything that you want to manage or report on about your workforce that is done on Rotomaster, automatic reports can be created just to save you a huge amount of time. So that might be something that you are interested in the future in terms of digitising your workforce. But that's everything that I wanted to cover today. And thank you all very much for your time in joining.